Hello everyone, my name is Suzanne Belibi. I'm a pediatrician, allergist and immunologist. I've been working at Grace Health Clinic for the past 10 years, and we continuing to talk about a series of coronavirus. At Grace Health Clinic, we've diagnosed so far around 70 patients out of 300 tested, and our patients did really well. Today, I would like to present the pediatric cases that we encountered. We believe that we had patients with a multisystemic syndrome caused by COVID long before it was known and talked about in the news.
I'm Fabiola. I'm a sophomore in high school, and I am a heptathlete for track and field. I've been a patient at Grace Health Clinic since I was born. Around 2 weeks prior to being really sick, I did have some cold symptoms at school actually. I had a headache in class and I decided to go to the nurse, and she took my temperature and she told me I had 101-degree fever and I should probably go home. But I had an activity planned after school, so I didn't really want to. So I just kind of brushed it off and toughed it out for the rest of the day. And then the next day there was nothing. So I thought I was fine. And then actually a week later, our family took a trip to Las Vegas because my sister was participating in the Pac-12 tournament. And we stayed there for around 3 days. And we left Sunday night so that we would still be able to go to school the following Monday. But we arrived here at around 2 a.m. and I actually never went to sleep because that's when the full symptoms hit. I had a very high fever. I was very hot. I was itching all over my body, even my eyelashes, like my eyelids. I had a very, like my head hurt a lot, and I actually got up around, I think it was 5 a.m. and I just put cold water on my face because I was just so hot. And then I still thought I was gonna go to school, so I woke up and I got ready, but I was shivering in the shower and I was extremely cold. I had 3 layers on, and my little sister actually, she saw me and she was like, "You can't go to school today, like you look terrible, you need to talk to our mom." And so she told my mom and we drove to the clinic that morning.
And when she presented to the clinic, she appeared very ill with chills, redness of her skin, confusion, irritability, and her vital signs at that time, the temperature was close to 102. Her blood pressure was 95/63, which is hypotension. Her heart rate was 118. Because she's a track athlete, usually her heart rate is below 65. So at this point, her heart rate was doubled. Her oxygen saturation was 93%, which was also low for her. Her capillary refill was within 3 seconds. So what was positive at her physical exam was the red eyes. Her eyes were extremely red. The skin on the face was very red, as if she had slapped cheeks. You know, there's a pediatric disease that we call the slap cheek disease, where the cheeks are extremely red. She had that look, but on top of that, she was just itching everywhere from head to toe. She was confused. She also had some sign of meningitis because her neck was really rigid. She couldn't really look up, and she had neck pain. Photophobia, meaning that the light bothered her a little bit. Her lungs had decreased breath sound, and she also had some crackles. She had headache at that time and extreme fatigue. She just wanted to lay down on the exam bed. So we did a rapid flu test. It was negative. And we have to remember that at that time we didn't really have the COVID test available. And we just had to go based on the patient's symptoms. What is the new multisystemic syndrome with the inflammation associated with COVID in children? Just as a summary, it's a newly identified syndrome that overlaps with signs of fever, inflammation, hypotension, and shock. Patients sometimes have abdominal pain, skin rash, bloodshot eyes, racing heart. There's usually exposure to COVID-19 previously. It can also mimic Kawasaki disease, which is characterized by fever, red eyes, red lips, red tongue, a rash, and cardiac signs. Usually a history of mild symptoms a few days before that is reported. So that's a new syndrome we've been dealing with recently. Our impression was either a toxic shock or multi-system inflammatory syndrome. Endotoxin is a particle on the germs membrane that can actually cause the immune system to overreact and create cascades of multiple reactions to the body. So what did we think about it? We know about the toxic shock syndrome from Streptococcus. It's been studied for the past 90 years and we know how it works. So if we look at that and we want to compare the membrane of, let's say, the strep with coronavirus, we will notice that they have something in common. Both of them have what we call the M protein. And that M protein is actually what is the culprit that we were able to identify on both germs. So if this is coronavirus, and of course I didn't make those pictures, I took it from different journals and publications, and I really want to acknowledge them for copyright purposes. But if this is coronavirus, we notice that coronavirus has multiple spikes on its membrane, and those spikes actually helps to protect it and to multiply. And if you notice here, it has what we call the M protein right there. And this M protein, those little yellowish triangles, are all over the membrane. Now, if we take the case of Streptococcus, which has been studied for the past 90 years and more, we know from studies, from research, that Streptococcus has M protein, which are actually lipopolysaccharides on the membrane that help the germ not only to attach itself to the host, to get into the host cell, continue to multiply and cause damage. But the M protein in coronavirus has also been shown to prevent phagocytosis. What is phagocytosis? Let's say we get infected with a microbe. We have soldiers in our body who will come and try to just swallow up the germs. But coronavirus, through the M proteins, prevents our soldiers in the body to swallow them up. So that's the first way they defend themselves. But that M protein also releases a signal to the body to let them know that there is a stranger. And because the type of signal it's sending, it's so, a dangerous signal, multiple cells will then try to attack the germ or the stranger in the body with different mechanisms. So if we, this is an illustration It's not very clear, but it's just very simple to explain how it happens. So assuming that this is the M protein that is in the host body, like in a human being, after inhaling coronavirus, this M protein is going to be recognized by the system and start activating the immune system. So the first are going to be the neutrophils. The neutrophils is part of our soldier, the immune system. But when the neutrophils come, because the M protein has a system to prevent it to be swallowed up, the neutrophils initially are not going to be able to swallow them up. But the neutrophils will start activating cytokines and calling other cells to help, like the T cells, the monocytes, and all that is going to create more signals to the body. Some of those signals, like IL-1, tumor necrosis factor, all those cytokines will increase the fever. So fever would be the first sign. But it doesn't stop there. It also activates another cytokine called IgE, immunoglobulin E, that is on mast cell. And those cells have histamine. And when they are activated, they release histamine and it causes itching all over the body. And we know that one of our patients had the itching from head to toe. But it doesn't stop there. It also activates the platelets and causes clot. Some patients get embolism in the lungs or other parts of the body. It also attacks the liver, the kidneys. So this endotoxin, with all the cascades it creates in the body, also makes leaks in the blood vessels that causes hypotension. And because of the hypotension, the heart is trying to compensate and is going to increase the rate to try to pump more. So classically, in shock, we will have in toxic shock caused by a germ, we will have the fever, the hypotension, and the increased heart rate. And we know that the M protein can do that. So if coronavirus is packed with the M protein, then we would assume that coronavirus can actually give all the signs of shock. So how does the shock work? There are different stages in the shock. So initially, the patient is going to be able to compensate. How does the patient compensate? With increasing the heart rate. But at some point, as the heart rate goes up, the blood pressure continues to go down, and the germ continues to attack and cause the fever. At some point, the patient gets to a stage where the symptoms become irreversible. And that's when it's usually too late. So it's very, very important to recognize the initial symptoms, which are hypotension, tachycardia, fever, and act very quickly. We believe that coronavirus has really two factors that make him very virulent, like very aggressive, I would say. And those two factors are the size. It has a very small size that can go directly into the depths of the lungs. And when that happens, usually we want that for the inhalers, patients who have asthma or lung conditions. We want to give them treatment through inhalers that can actually go directly down to the lungs and start helping. But coronavirus size is so small that it can also go deep in the lungs, bypass all the upper airway protections that the host has, and begin to attack the lungs. The second component, I believe, that makes it very aggressive is the M protein, because that M protein can prevent some of our soldiers' cells to swallow up the virus, but it can also cause the toxic shock, some shock symptoms, especially if it's a mutant form of the M, because coronavirus also has the ability to mutate very quickly. Therefore, looking at that and knowing where to attack, we came up with two treatments for our patients. The first one was the shot of cephalosporin. Why a shot? Cephalosporin, ceftriaxone or rocephin, all that is the same name. It's a third generation. Third generation means that it can go through the brain. It can actually go through the brain. But the fact that we give it intramuscularly in the pediatric setting office, because we might not have intravenous access, or the patient may be so dehydrated or hypotensive that we actually cannot find the vein, we give it through the muscle, and it's going to go directly into the system faster than if we give it per mouth. So knowing that and knowing what cephalosporin does by disrupting the M protein, it locks it down and prevent the M protein to continue to work. Therefore, it disrupts the membrane of the germ, in this case coronavirus, and it cannot continue to reproduce or multiply itself. That's what the cephalosporin does. Now, why did we think about Tamiflu? We know from experience that patients who have influenza, when we give them Tamiflu, they do better. But what does Tamiflu actually does? When the germ goes into the cell, it uses all the nutrients and all the products, inside the cell to build itself. And then it has to come out of that cell that was destroyed to attack another cell. So Tamiflu actually blocks the exit of the new formed virus to go to another cell. So we thought that if we can give a medication that will disrupt the cell membrane, and then another medication that will prevent the virus to come out of the cell and attack another cell, then we would inactivate the whole process. And that's what we did. So if we look back at coronavirus here, the membrane, we would assume that cephalosporin will attack the M protein and disrupt the whole membrane. And then Tamiflu would actually prevent, so if this is coronavirus, comes in here, uses all the cells products to get built and go back out to attack other cells, then Tamiflu would prevent this to happen. So there wouldn't be any budding or any exit from the cell. And that's exactly what we give to our patients.
After I got the shots, I felt so much better. So it hurt a lot, but I think that was exactly what helped me. I also did get Tamiflu, I believe, pills, so that helped a lot as well. And I moved to a different room to just sit and relax, and I was able to eat and drink more comfortably. I went back to school the next day. I went to practice that same day. I was perfectly fine.
If we look at coronavirus and how it attacks the human body, and we look at the symptoms that it causes, especially in children, we could potentially use cephalosporin third generation to stop the process of the M protein, and Tamiflu as necessary.